Welcome to our discussion on how stains become crucial tools in forensic histopathology. We're moving beyond just identifying tissue types. Here, stains help us unravel the story of a death. In forensic work, the choice of stain isn't just about aesthetics or routine. It's about extracting critical information that can confirm or refute a hypothesis. We use these stains to highlight specific cellular changes, foreign materials, or even the timing of an injury. This precision helps us differentiate between disease processes, trauma, and postmortem changes, which is vital for accurate death investigation. Understanding the capabilities and limitations of each stain is paramount to providing reliable evidence. Let's dive into how these tools help us answer the fundamental questions of forensic pathology. While H&E remains our foundational stain, providing a broad overview of tissue architecture, it's essential to recognize its inherent limitations in forensic contexts. H&E is excellent for general morphology, but it can miss subtle yet critical details that special stains are designed to reveal. For instance, early myocardial infarction or minute hemorrhages might be overlooked with H&E alone, especially in cases with significant postmortem changes. This means relying solely on H&E can lead to incomplete or even misleading conclusions, which is unacceptable in forensic investigations. So while H&E is always our starting point, we must be prepared to go beyond it to uncover the full picture. This leads us to consider when and why we need to employ more specialized techniques. Building on the idea that H&E has its blind spots, the most effective approach in forensic histopathology is to start with a clear question, not just a standard protocol. Instead of blindly applying a battery of stains, we first ask, what specific information do we need to confirm or exclude? This question-driven approach ensures that we select the most appropriate special stains, saving time and resources while maximizing diagnostic yield. For example, if we suspect a specific type of injury or disease, we choose stains known to highlight those particular features. This strategic selection is crucial because each stain provides a unique piece of the puzzle, and we need to know which pieces are missing. This focused methodology helps us avoid unnecessary procedures and concentrate on obtaining relevant forensic evidence. Following our principle of starting with a question, timing becomes everything when considering stains like Prussian blue and trichrome, especially in cases involving hemorrhage or fibrosis. Prussian blue, for instance, detects iron, which is critical for dating hemorrhages. Fresh blood won't show iron, but as red blood cells break down over days, hemosiderin forms, allowing us to estimate the age of a bruise or internal bleeding. Similarly, trichrome stains differentiate collagen from muscle, helping us assess the age of wounds or the extent of fibrosis in organs, which can indicate chronic conditions or healing processes. These stains provide temporal context, allowing us to determine if an injury occurred before or after death, or how long a disease process has been active. This temporal precision is often vital in reconstructing the events leading to a death. Moving from the timing of injuries, we encounter another critical decision point with lipid stains, which absolutely require a decision made before tissue processing. Unlike many other special stains, lipid stains like oil red O or Sudan black B are designed to detect neutral fats, which are soluble in the organic solvents used during routine processing. The tissue is processed through xylene and alcohol. All the lipids will be dissolved away, rendering these stains useless. Therefore, if there's any suspicion of conditions involving fat, such as fat embolism or fatty liver, a portion of the tissue must be snap frozen or fixed in a non-lipid dissolving fixative, and then sectioned as frozen sections. This highlights how early decisions in the lab directly impact our ability to gather crucial forensic evidence later on. We must anticipate these needs to avoid losing vital information. Infection stains are crucial in forensic histopathology because they can turn a suspicion of infection into documented evidence. This is vital when the gross autopsy might not definitively point to a microbial cause of death. We're talking about specific stains like Gram for bacteria, GMS for fungi, or AFB for mycobacteria. These stains allow us to visualize the pathogens directly within the tissue, confirming their presence and often their morphology. This direct visualization provides objective evidence, which is critical in a forensic context where every finding must be defensible. It moves us beyond speculation to a concrete microscopic confirmation of infectious disease. Now, let's broaden our view to other specialized stains that form our forensic toolkit. Beyond infection, many other targeted stains provide critical information, acting as a forensic toolkit for specific questions. For example, again, stains for iron like Prussian blue can identify hemorrhage or hemosiderin, helping to date injuries or assess chronic bleeding. Connective tissue stains, like I mentioned, like Massange trichrome, differentiate collagen from muscle, which is useful in assessing wound healing or fibrosis. Elastic stains, like the Voorhoff van Giesen, highlight elastic fibers, essential for evaluating vascular integrity in cases of aneurysm or dissection. Each of these stains answers a very specific question about tissue composition or injury. But remember, the utility of any stain, no matter how targeted, hinges entirely on its preparation. So, let's talk about that next. A stain is only as trustworthy as its preparation, and this is where your expertise as a histotechnologist becomes paramount. The quality of the staining process directly impacts the reliability of the results. Factors like proper fixation, correct section thickness, and precise adherence to staining protocols are non-negotiable. Overstaining or understaining using expired reagents or inadequate washing can all lead to misleading results. In forensic work, a poorly prepared slide isn't just suboptimal. It can lead to incorrect conclusions about the cause or mechanism of death. You are the gatekeepers of quality, ensuring that the pathologist receives a slide that accurately reflects the tissue's true state. However, even a perfectly prepared stain can be misinterpreted if we don't understand its limitations. Knowing what a stain shows is not enough. You must also know when it can mislead. This is a critical distinction in forensic histopathology. Artifacts, for instance, can mimic true pathology. Pigment from tattoo ink might be mistaken for hemosiderin, or postmortem changes could be misinterpreted as vital reactions. Nonspecific staining can also be an issue, where a stain picks up unintended elements leading to false positives. Understanding these potential pitfalls requires a deep knowledge of both the stain's chemistry and the tissue's postmortem state. It's about critical thinking, not just pattern recognition. We must always question what we see and consider alternative explanations. This brings us to our final point. Stains are questions, and we must ask the right ones. Ultimately, stains are questions, and our job is to ask the right one to get meaningful answers. Selecting the appropriate stain requires careful consideration of the clinical history, gross findings, and the specific forensic question being asked. We don't just throw every stain at every tissue. We choose based on a hypothesis. For example, if we suspect a fungal infection, we use GMS. If we're looking for early myocardial infarction, we might use a special stain for glycogen or enzymes. This deliberate approach ensures that we are effectively and efficiently extracting the most relevant information from the tissue. It's about precision and purpose in every step of the process. Thanks.